everyone, this is Erin. Today I'm going to be talking to you about pain as the fifth vital sign and how it may have contributed to the opioid epidemic that we are seeing now in the United States. So in 1996, the American Pain Society instituted pain as the fifth vital sign. The aim of the campaign was to make pain assessment and its measurement just as important as the existing 4 vital signs. That includes body temperature, pulse rate, respiratory rate, and blood pressure. So over the next 20 years, the U.S. healthcare institutions adopted pain as the 5th vital sign, and physicians began to assess their patients' pain using self-reported unidimensional numerical pain scale. So in order to promote action, they started to red flag any elevated pain scores. So this was all in an effort to reduce the burden of underassessment and the inadequate treatment of pain in their patients. So here are 2 examples of numerical pain scales that you probably have seen in your doctor's office or at the hospital. The one on the top is the most commonly used, 0 being no pain, 10 being the worst possible pain. On the bottom is called the visual analog scale. This sometimes is used by healthcare providers if their patient cannot verbally speak and let them know how much pain they're in. They'll use their facial expressions in order to determine the pain level. Of course, both of these scales are very subjective and really depends on the person reporting the pain and the person analyzing the pain. So there's a patient satisfaction survey that is used by CMS that actually facilitates reimbursements for U.S. healthcare providers. So after pain was named a vital sign, several of the questions in the survey were added, and they were directed towards the patient's pain and how well it was controlled during their stay. So this made it so doctors would be judged based on how well their patients were satisfied with their pain management. This, combined with the poor estimation of the risk of opioids, drove physicians to overprescribe narcotics as well as prescribe them even when they weren't needed. So what were the consequences? Unfortunately, they were pretty bad. As a result, it has been suggested that adding pain as the 5th vital sign, along with using the numerical pain scale, has contributed to the opioid epidemic that we are seeing in the United States. These organizations here, American Medical Association, Joint Commission, Centers for Medicare and Medicaid Services, all of these organizations have withdrawn their advocacy for the pain as the 5th vital sign campaign. And I personally think that speaks volumes. So the opioid epidemic. It's a huge, major problem in the United States, both social, medical, financial. It's not only an epidemic, but is considered now a national emergency. There have been at least 600,000 deaths in the U.S. from prescribed opioids. Another 180,000 are predicted by 2020. And just to put that in perspective, more deaths are caused by opioid overdoses than car accidents. In 2016, it was estimated that the combined economic effect of the opioid epidemic was $92 billion. So what is being done? As a result, there is a movement within the United States, first, to abolish the pain scores as a surrogate outcome measure of good care. Also, stopping the exclusive use of the unidimensional pain assessment tool, the numerical pain scale that we discussed, and it's again here on the bottom of my screen. again, I am repeating myself, but it is so subjective. And with everything that we know now, I feel that using solely this tool is very archaic, and there should be at least many additional tools used in order to address pain. And last but not least, end the direct relationship between the provider reimbursement and the patient self-reporting of pain. I think this one is a big one. Money talks, and where there's money, sometimes there's not always the most ethical decisions that are made. So I do feel that when it comes to the physician's role and physicians prescribing medication, I think this is a key factor. So there is another side to the story. Not everybody wants the pain to be removed from the vital signs. A lot of people say it'll make it more difficult for pain sufferers to have their pain properly treated. Some feel that removing pain as a vital sign would cause physicians not to assess the pain regularly. The whole point of the campaign back in the 90s was for the patients. It was to help the patients, because there were a lot of people that were falling through the cracks and that weren't having their pain managed correctly. Some people are concerned that, ignoring the pain and not dealing with the pain and then getting rid of opioid abuse will just disappear, and thinking that this is false. And it is false. I don't think that anyone would agree that pretending the pain is not there so that we don't have to deal with it, not prescribe the medicine, that it will disappear. That I think we can probably all agree is not going to happen. Interestingly enough, I actually have experience on both sides of the spectrum, and that's why I chose this topic. It hits very close to home. I've had several family members become addicted to opioids after having surgery, after stealing medicine from their parents' cabinet because they had surgery. And then on the other side, I have a mom who has chronic back pain, and she uses medication every day, and she's always in pain. Even with the medication, it just takes the edge off. And so I know that she needs it. She takes it on time, never before, never too much, always the same dose that her doctor says. And so she is somebody who takes it daily and needs it to function, and has not become addicted to it. So I worry for her that taking away the vital sign for pain, or pain as a vital sign, could possibly hurt her in the future, and maybe not cause her doctor to be to not care as much, or not to care, but to not assess it as regularly. However, I also have family that have almost died from overdoses, and so being on both sides of the spectrum, I wanted to know what you guys think. I wanted to hear what your thoughts were. So some things to consider. Do you feel that pain should be considered a vital sign? Why or why not? Do you feel that pain management questions and patient satisfaction surveys are driving the opioid epidemic? And should those questions be removed? And last but not least, should pain management be equated with the quality of healthcare? Again, this is a really passionate topic for me. I've wrestled with both sides, so I'm really curious to see what you guys have to say. Thank you so much for being with me tonight, listening to all of my thoughts and information, and looking forward to seeing what everyone says over the next couple of weeks. Thank you.